Hi, good afternoon, everyone. It's good to see you all. We do still have some folks coming in from the waiting room, but we appreciate you all taking the time to join us today for our state and federal policy updates. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health, and I'm a member of the ThriveKY Coalition, and here today with some of our partners to give you these updates. We can go to the next slide. And I know many of you probably joined us just last month, either for our roadshow or for our Thrive Forum with the Cabinet for Health and Family Services. And today we're going to be touching on maybe a few of the things that we discussed then, but also sharing some new updates with you about things that are changing, things that are on the horizon, and advocacy opportunities. So if you're new to Thrive Kentucky, we are a coalition working for a strong and equitable safety net. And we want to make sure that every Kentuckian has the opportunity to thrive. So what you see on this screen, these are our guiding principles. When we work on policy and system change, we want to make sure that those changes are really being guided by these principles, making sure we are leveling the playing field for Kentuckians, removing barriers, making systems easier to use and more accessible. So there are a lot of words on this screen. You'll get a recording, you'll get the slides as a follow-up. If you want to learn any more about Thrive, you can take a look at that. And on our next slide, you'll see links to the organizations that are part of Thrive Kentucky. And all of these are hyperlinks, so you can learn more about our organizations and how to get involved. We can go to the next slide. We always want to say thank you to our sponsors for supporting this work and making it possible for us to provide these webinars as well as our in-person roadshow events for free at no charge to folks, and for covering the cost of CEUs. So appreciate that. We accept new sponsorships year-round. We do this work year-round. And so if your organization is interested in sponsorship, please reach out. Kelly Talby's contact information is on the screen. Our sponsorship flyer is linked there, and you'll also see her email in the chat. We can go to the next slide. And I mentioned already some of our other webinars, our forums with the Cabinet for Health and Family Services, our roadshow, which is in person in different parts of Kentucky, which we really enjoy going to visit different communities and learning what's happening, what policies are working well for those communities, what policies aren't working so well, and what some of the needs are. You can see here the schedule for the rest of the year. We would love for you to continue to join us for any of our upcoming webinars or roadshows. And in December, we'll have more details soon about having a virtual roadshow event. We always like to end the year that way for anyone who may have missed the in-person events that we hold. We can go to the next slide. And then this is the agenda for our call today. You know, we like to really stack it full of information and updates. Today will be no different. I'm going to cover some federal updates, and then we'll get into more of the state-based updates that we want to share with you all. Let's go to the next slide. Just a little bit of housekeeping. Everyone should be muted, and if you could just make sure that your line stays muted while we're talking, since we have so many folks here on the webinar today, and we are doing a recording. You can use the chat to ask questions, to share comments. We really do love for this to be interactive, and as we go along through each section, we'll stop and try to address any of the questions or comments in the chat. So definitely use the chat as much as you can. And if we don't get to any questions or to some of the questions that we see in the chat today, just for the sake of time, we'll make sure to get answers out to everyone in that follow-up email. We didn't get any questions that were really specific with registration, but if you do have questions, you can go ahead and type them in the chat now. You can wait until the section that you're really focused on, but we'd love to hear from you. And then as far as CEUs go, we offer CEUs for certified community health workers and for social workers, as well as for professionals who can independently apply for CEUs. And so you'll get information in that follow-up email. You'll have to take the evaluation in order to get the CEU, so just keep that in mind. But of course, we want everyone to give us their feedback. And I already that you'll get in a couple of days with the recording, the slides, any of the resources that we share today, and that evaluation. And just one other note, if the view looks different to you today, I know many of you have joined us for webinars over the years. We are doing something new because the last two Thrive calls that we've had, we've been Zoom bombed, and we don't want to do that again today. So you'll be able to see any of the presenters on your screen. You won't be able to see each other as participants, but we hope that that will keep us from having another unwelcome guest. We can go to the next slide. And I'm going to start us off with a few federal updates. This by no means is comprehensive. There's so much going on right now. We'd be here all day, but I wanted to highlight a few things for you and some opportunities for advocacy. So first and foremost, the thing that I think we're all hearing about now in the news, we are back facing yet again another government shutdown or the potential of a shutdown if Congress isn't able to act on a full set of appropriation bills by the end of this month, just 2 weeks from now. One way that they can act if they're, not ready to pass a budget for the full upcoming fiscal year, and I think we know that that's not really in the cards right now, there's going to likely be a continuing resolution. There will absolutely be a vote on a continuing resolution, probably later this week. Whether or not there are the votes to pass that, I think is really what's in question. Right now, we know that the White House wants a clean continuing resolution, and what clean means in this context is, kind of the flat funding, what's been appropriated already would just be extended. The White House is wanting that extension through the end of January 2026. Congress, on the other hand, at least what we're hearing right now from congressional Republicans and leadership, they're considering a shorter term continuing resolution that would fund the government through November 20th. Now, even with a clean continuing resolution, that's still flat funding. So there wouldn't be any increase for, the increase in cost of living, for inflation, that sort of thing. So programs that, are currently funded that would be extended would still potentially be facing some cuts in the amount of funding that they truly need to fully fund their programs. But that would be much less severe than if we were facing a partial or a full government shutdown in which many, many parts of our government would have to just stop operating altogether, and we would have federal staff furloughed. So you can see here the Congressional Budget Office put together this graphic just showing, discretionary funding and what's non-military and or non-defense and what's defense in that vein. And I've linked to that in case you're interested in learning more. But a lot of health funding, a lot of feeding programs, housing, and many, many more really essential programs for Kentucky families could be at risk of having to be shuttered during a shutdown. So this is something we hope to avoid at any cost. We know that many Democrats in Congress are really looking to extend enhanced subsidies for the marketplace because right now we have millions of Americans, about 100,000 Kentuckians who are relying on these subsidies for affordable health care and their health insurance in 2026. And so that's one of the bargaining chips that's on the table right now and that we're watching really closely. And so as advocacy opportunities go, we really want to put pressure on Congress to use the continuing resolution as a vehicle for extending these enhanced premium tax credits for the marketplace. And people need to know sooner than later if this extension is going to be in place for 2026, because open enrollment is going to be starting any minute now. And of course, insurers are already, getting their plans approved to offer to sell for next year. And then also incredibly important, and another big piece of this, sort of the negotiations that are going to go on, is that the final package includes some guardrails around things like rescissions and impoundments. Rescissions, if you're not familiar with that term, that's essentially unilateral cuts. The administration choosing not to spend money that has been appropriated by Congress, that Congress said, we want you to spend this amount of money on housing or this amount of money on healthcare. And impoundments are delays in spending that money. And since this has become an issue, a real issue this year, in which a lot of money has not been spent that was appropriated by Congress, we want to make sure that there are some more guardrails in anything that gets passed. We can go to the next slide. So a little bit more about that temporary extension of APTCs, or the advanced premium tax credits that many Kentuckians qualify for to purchase marketplace coverage at a lower premium. These enhanced premium tax credits expire at the end of 2025 if Congress doesn't act. And just to put in context for you what that means for Kentuckians, the average monthly premium would more than double in 2026. So when people, start open enrollment and go shopping for a plan, the same plan that they have today, their premium would be more than doubled on average. So you can see how premiums jump from an average of $139 a month to $327 without those enhanced premium tax credits. And we would be looking at about 6,700 Kentuckians losing that premium tax credit entirely. They would have no subsidy to, reduce the cost of their coverage. Another 77,000 would have much less subsidy. So this is a big deal for a lot of Kentucky families, a lot of people who are working in small nonprofits like ours at KVH, people who are self-employed, people who are, for one reason or another, unable or don't have access to employer-sponsored insurance, or just, it's not affordable for them. So we need Congress to take action on this, if not with the continuing resolution, through one of the three bills that has been introduced. There are two permanent solutions here, which would extend these enhanced tax credits permanently. And you can see that linked, the Protecting Healthcare and Lowering Costs Act of 2025. There's both a Senate and a House version. And then the temporary solution is bipartisan, introduced by a number of Republicans and Democrats just recently, and that would provide an extension only through 2026. Now, that's better than nothing, and of course, we're going to be advocating for it, but we really need a permanent solution to keep the cost of health insurance down for families. We can go to the next slide. Now, we've talked a lot on the last few calls about the impact of the One Big Beautiful Bill. Of course, it passed in July. We are looking specifically at the rural impact here in Kentucky, because we know that it will be really, really severe. We have a lot of Kentuckians living in rural areas, and we have 35 of the hospitals that are at risk of either closing or having to cut services, and they're all in rural areas. We also know that we're going to be losing a lot of federal funding, and that's going to have a disproportionate impact on our rural communities, particularly because we have higher Medicaid enrollment in most of those rural communities. So for all of those reasons, we're going to need focus in finding ways that we can support rural providers. And part of that bill was a $50 billion transformation fund. Now, that is really just a drop in the bucket. As you can see, we're losing about 3 times that amount of money in funding to these rural providers. But Kentucky needs to get as much of that funding as possible in order to kind of prop up our healthcare system and to be more prepared for these changes. And, while transformation seems maybe aspirational, certainly anything that we can do to make sure that the health system is a little bit more prepared to serve Kentuckians and to be more creative in how they do that, the better. We can go to the next slide. So what you see here, this fund is a 5-year fund from fiscal year 2026 to 2030, and it would be appropriating $25 billion distributed equally among all 50 states. And then $25 billion would be allocated based on some specific rural metrics, such as how many, what percentage of the population is in rural areas, the number and the conditions of the health facilities. And Kentucky actually has many. We're second, actually, just to Texas. Other types of needs that CMS, prioritizes. They have been really clear that these funds can't be used to just replace lost income or to support an existing program that's already federally funded. They're really looking for something that is, in their words, transformative, more efficient, really leveraging technology to improve health and also looking at sustainability, something that is going to, continue beyond that 5 years. And so CMS just released the notice of funding yesterday, actually, so you can link to that there. And then the application from every state will be due November 5th with awards announced by the end of the year. Kentucky received 40 sets of recommendations from stakeholders. So there's been a lot of activity here, a lot of interest and input. And so they're working now with a consulting group to synthesize those recommendations to develop that application. Dr. Stack recently testified to the Medicaid Oversight and Advisory Board and said, that we're still open to conversations. We still want input, but the time frame is really a challenge here. So if you didn't make that deadline, feel free to reach out. But I will say that they're going to be working really fast to get this done. You can read more information about the Rural Health Transformation Fund. It was a summary provided by Dr. Stack at the link at the bottom of the screen there. We can go to the next slide. Just some more federal activity, and I won't go into detail here, but wanted to just put it on your radar and share some links and resources with you if you're interested in learning more. The White House has released their Make America Healthy Again report, so you can find more information. It includes recommendations. CMS has updated guidance on Medicaid state-directed payments, and that's actually the first guidance that we've seen for the One Big Beautiful Bill, and much more to come, of course, but this came out pretty quickly. You can see the guidance link there, and then I already mentioned the Rural Health Transformation Fund. We can go to the next slide. There's a lot happening right now around vaccine access and what future guidance will be. I'm not going to go into the details here either, but just to put on your radar, there's a lot of confusion around access to COVID vaccines in particular. The Pharmacy Board here in Kentucky did recently issue some guidance because they were getting so many questions from pharmacists and others. And the good news is you can still get your COVID vaccines at pharmacies, and they're still approved to be administering those without a prescription. Now, some other things to watch for, there's going to be some testimony in committee, in Congress this week around political interference in vaccine policy, and then the advisory board on immunization practices is meeting later this week. And that's where they really get down to what the guidance will be and what vaccines will be approved for which populations. And so we're going to be watching that closely, and we'll share any updates on probably our next call. I think that's the last slide I'm going to cover. And I'm going to, just always contact your federal policymakers. Right now, the message really needs to be around the continuing resolution and the extended premium tax credits for marketplace plans. But please do give your legislators a call and let them know that we absolutely need to protect these tax credits and affordable health care for Kentuckians. With that, I'm going to turn it over to Dr. Sheila Schuster.
Thank you very much, and good afternoon. Let's go to the first slide here, please. So we are in the middle of the interim session, started in June and will go through November. They can't pass legislation, but this is a great time for you to be in touch with your legislators, and I would just like to remind you of that. They're not so busy with legislative stuff. The committees, the House and Senate committees meet together. So House Banking and Insurance meets with Senate Banking and Insurance. So if you have an idea to present or you just want to know what they're talking about for next session, it's a great time to monitor that. All of the interim session committee meetings are covered on either by KET or by the LRC YouTube channel. And let's go to the next one and look at the task forces. So 5 task forces, 3 of them are new and 2 are continuations of task forces from last session. I've put the remaining meeting dates and times for each one of those. I think for the people concerned about housing in particular and about health, the Disaster Prevention and Resiliency Task Force is important. That's a new task force. We were very pleased to see the Kentucky Housing Task Force was reauthorized, and I'm sure Adrian will be talking about that. And then there is a Make America Healthy Again Kentucky Task Force. So if you want to hear, they've been looking at food insecurity, they've been looking at vaccinations, a good way to kind of get a temperature check with the legislators. Next, please. So the most important thing that will happen in the 2026 session, it is a long session, is the preparation of the 2-year or biennial budget. So the interim session is very full of meetings in preparation for that. And I think we are all concerned about the budget. For one thing, as our friend Dustin Pugel from KY Policy always says, the budget is really a moral document. It really sets the priorities for the Commonwealth, just as you set the priorities at your home or in your business for what things are most important. So we always want them to put people first. And I think we want to be looking at the budget. Not only is it particularly important this year coming up, because of the deficits in funding that we're going to get from the feds and probably in Medicaid and also in food security. So we're looking to see whether they're going to budget some of that replacement money. So there are budget review subcommittees on different topics that I've listed those here. Again, many of you will be interested, I think, in the justice VR, the education, probably the transportation, but also the health and family services. And you can follow those meetings. They are going to be meeting on September 17th, that's tomorrow, and the BRs will meet at 9 and at 10:30, October 15th, and then November 5th. And again, the morning sessions are 3 of the BRs meet at 9 and 3 meet at 10:30. And then at 1 o'clock on those same dates, the Interim Joint Committee on Appropriations and Revenue, which is the House and Senate A&R committees, meet together. So monitoring those meetings, and again, you can do that live or archived. I always say you can be in your pajamas with your favorite beverage in your hand and watch some of the action, but it will really give you a window into what the thinking is around the budget. Next, please. So one of the big things that happened in this last session was a new statutory committee was established. That's the Medicaid Oversight and Advisory Board, affectionately known as MOAB. And it brings a really big change to our Medicaid program because it really brings the legislature much more into the picture. The purpose is listed here, but when you look at it, it is really kind of makes your eyes open wide. They're going to review, analyze, study, evaluate, provide legislative oversight, and make recommendations to the General Assembly regarding any aspect of the Kentucky Medicaid program. So we're talking about benefits and coverage policies, payment methodologies, delivery service. I mean, everything that we think about for Medicaid, the legislature wants to now have a voice in, and they want to do it through the MOAB. Next, please. So there are 10 voting members. I won't go through all those names, but the co-chairs are Senator Julie Rocky Adams and Representative Ken Fleming. And then there are another 15 non-voting members. 4 legislators, the chairs of A&R and 2 other legislators. And then there are 11 citizen members who have a voice but no vote. And they include the Medicaid commissioner, the chief medical officer, Dr. Stephen Stack, who also is the secretary of the cabinet, the auditor, the state budget director, 4 citizens, 2 appointed by the Senate president and 2 appointed by the House Speaker, the head of the Rural Health Center of Excellence, a representative of the MCOs, and then yours truly as chair of the Medicaid Advisory Council. Next, please. So these are some of the things that they're going to do. They're going to start in 2026 doing every 5 years an in-depth study. And you can see that first year is looking at administrative costs, and then the next year they're going to do a program evaluation. It is a very robust and far-reaching agenda that they have set for themselves. Next, please. So here's the link to the interim session, and I would advise you to check because they change it about every month. The Moab meetings are set for September 24th, October 22nd, and November 12th. There is a public comment period added to the end of each Moab meeting, but you have to be able to be in Frankfurt to sign up for that at the beginning of the meeting. And then all the materials are available online, and they're also streamed. Next, please. So just a reminder that you have 2 ways to participate in our democracy, and I think this is a time when we are concerned about our democracy. One is with your voice and one is with your vote. Since 2025 is not an election year in Kentucky, although there's already been so much discussion about upcoming elections in 2026, the legislators that are in office now will be the legislators that we will be dealing with in the 2026 session. So again, I really urge you at this time to reach out to your legislators. You have something in your resource document about a good way to do that. Introduce yourself as a constituent or someone who works with constituents of that legislator. Let them know what you're concerned about, but get to know your legislators because they're going to need to hear from you and you're going to need to speak up. Just remember that you could also influence others to vote and to speak out. And I think that's the end of my, turning over to colleague Jessica. Thank you.
Hi, good to see some friendly faces. I'm Jessica Klein with Kentucky Center for Economic Policy, and I'm here to talk about our food assistance programs in Kentucky. So a little bit of the state of hunger in Kentucky. We are the 7th hungriest state in the nation, and hunger is increasing along with grocery prices. We're facing about 15% of our population being food insecure, which means they don't have access to enough food to thrive. And that's about 1 in 4 children in Kentucky as well. And we also have the second highest rate for our older adults, people 50 to 59. But our best tool against hunger is the SNAP program, Supplemental Nutrition Assistance Program. We serve about 560,000 Kentuckians with this program, but that is not enough. We're reaching only about 65% of those eligible for the program. The average benefit is about $174 per month. So again, very much a supplemental program, not providing a full food budget for those folks. And really, participation is dependent on policy. A lot of the gaps and dives in this graph here reflect how the program is administered and the policy decisions that are made. And unfortunately, at the federal level, the One Big Beautiful Bill Act will have a significant cut to SNAP over the next 10 years. And this comes in a lot of different ways. So I'm going to slow down and kind of explain all of these to you all so that we collectively can keep track of these as they change SNAP in Kentucky. But the first is a cost shift of the funding of SNAP. So SNAP has, for the last 50 years, been a federally funded program. That is no longer. It is now being pushed on to states to help pay for the program. So in Kentucky, that's going to begin in 2028. And this is dependent on an error rate, but it also has an administrative cost that's included here. So we're looking somewhere between 50 million to 253 million. Again, we don't know the final number because we don't have that 2025 error rate just yet. And what an error rate is the amount that people are either overpaid or underpaid. And that's based on issues that sometimes happen at the agency side or on the individual side. So it's a really volatile number and it changes a lot from year to year based on, policy changes and just the people who are applying for the program. So we're not really sure the total amount just yet, but that's something we will keep you all updated on as we learn more. The next major shift in the program is that it expands the work reporting requirement in SNAP. And what this reporting requirement is really inefficient at changing work outcomes, but is very efficient at creating red tape for people that participate. So we're looking about 114,000 Kentuckians that will be subject to this work reporting requirement. And the new groups in there are families with teens over 14, older adults 55 to 64, veterans, people experiencing homelessness, and former foster youth. There are also a group of counties that have been waived and that economic requirements to be waived from this program. And that waiver is going to end in November. So those folks will have to also do that work reporting in 117 of our counties starting in December. A few of these changes are starting in October, so I definitely want to mention these since they are coming up soon and notices are actually starting to go out this week around these changes. So the first is the ending of the standard utility allowance flexibilities. This deduction is now only for households with older adults and people with disabilities. And there's also the elimination of the internet deduction that we have been using in Kentucky. So both of these deductions will no longer count in your SNAP benefit calculation. This is also happening at the same time as a cost of living adjustment to the SNAP benefit. So really how that evens out is not everybody is going to see a change from this. We're looking at about 28,000 households that will see a deduction of about $10 to $14 per month in their SNAP benefit. So again, not everybody who participates in the program, but definitely tell folks to be looking in their mailbox for those notices starting this week and through October for those changes. The other pieces that are going to change are ending eligibility for legally residing immigrants, so asylees and refugees, and the ending of the Thrifty Food Plan. This is a process over time that changes the SNAP benefit. The Thrifty Food Plan adjusted benefits to take into account healthy food and nutrition in the benefit calculation. So that will no longer be included. And CBO estimates that's about a reduction of $14 per month over time. So over time, that means healthy food will be harder to access for people with SNAP, but that will be ongoing. And another consequence of these SNAP cuts, in addition to Medicaid cuts, is that it will impact school meals as well, and as well as several other child nutrition programs. And what this means is these programs utilize SNAP and Medicaid participation in their calculation of how much those programs cost and who all qualifies. So that means fewer schools will be able to provide free school meals through this program, the community eligibility provision. But that also impacts several other programs, including summer food service program, summer EBT, WIC. They will also see reductions in participation with the reduction in SNAP and Medicaid participation. Next slide. And a little bit more about the work reporting piece that's changing. I just want to emphasize for people that are new to this or who are newly going to have to implement it with the end of those waivers in December is that people that are applying for SNAP or want to keep their SNAP should really keep an eye on the exemptions from this requirement. There are several in place, including like if you're enrolled in school or training program, if you participate in SNAP employment and training, if you're considered physically or mentally unfit for work, those can all count as a exemption from having to do this monthly reporting. And really missing the report means that if you do that 3 months out of 3 years, it will result in losing your food assistance. So it's important that anybody that is exempt is able to get those exemptions. So trying to make those super clear. One that I really want to point out is that the exemption was removed for veterans, people experiencing homelessness, and former foster youth. And those could be considered unfit for work. So that's something to discuss with a caseworker if you have somebody who might meet that exemption, that they may qualify as unfit for work if they're able to. So I want to point that out. A few other pieces that I want to mention that are being discussed in their interim committees that Sheila mentioned, including the MAHA task force, are SNAP restrictions. And there was a bill last session that was withdrawn. But this is really a policy we've been seeing across the nation pop up. And on its face, it sounds helpful. So it's nutrition requirements within the SNAP program. But what it actually is restricting what people can buy with their SNAP benefits. And what we know is that purchasing patterns don't differ between SNAP participants and non-participants, that this is not a public health proven approach to address nutrition, and that there are alternatives to this that would be much more appealing and proven to improve nutrition, including Kentucky Double Dollars in Kentucky, which is where people can double their money at a farmer's market or grocery store. And then finally, I want to talk a little bit about the summer EBT program and how it went this year. This is the program that provides grocery money during the summer months to address that increase in child food insecurity that we see every summer. Next year, it's going to be called Sunbucks. So keep an eye out for that new name. But this year, we've reached over 376,000 Kentucky students, and we're able to provide them with $120 in grocery money. This is great too because families are able to spend that grocery money quickly, and it means that they're getting access to the food they need during the summer. Families with other public assistance programs, SNAP, Medicaid, and KTAP, automatically qualify. So in the early summer, a lot of people over 340,000 automatically received those benefits, and the rest had to apply. If they received free and reduced meals in school, then they qualified for this program. This is a use it or lose it type of program. So definitely want to encourage anybody who received those benefits this summer to definitely use those benefits as soon as possible. They have 122 days to do that. But that means if they receive them in early summer, they got that auto issuance, then their deadline is coming up. So you better use those benefits. And then I will end with sharing some resources here, some good links to some of the most important food assistance programs in Kentucky. So I hope you check those out. And with that, I will pass it on to our next speaker, back to Sheila.
And hello again. I am a licensed psychologist, and I run an organization called the Advocacy Action Network, and also a longtime board member of Mental Health America. So one of the things I want to remind you is that we often hear about the social determinants of health, and of course it makes sense that there would also be health-related social needs for mental health. And there are many of the things that we talk about on here, like food insecurity, poor housing, poverty, and lack of education and so forth. So just to put that kind of context out there for you all to think about when you're thinking about behavioral health. Behavioral health means both mental health and addiction. Next, please. So Medicaid behavioral health has been under increased scrutiny. One of the things that's happening is that we have prior authorizations have been started, which means that if I'm, as a provider, want to order certain sessions of therapy or certain interventions with someone, in all likelihood, I will have to get the okay from a managed care organization. And the problem is that often is time consuming. It has its own set of delays built in, and we really don't want people to be delayed in getting services. So it started in late in July, and we are still working with DMS and the providers to work through some of the rocky start that we started out with. The other thing that's in House Bill 695, which is the bill that authorized the start of the MOAB, requires DMS to monitor utilization rates and expenditures for all behavioral health services and to report on those services that have increased by 10% or more in that year. We believe that most of that uptick in utilization has been around the substance use disorders and the treatment there, but it'll be interesting to see what that data looks like. Behavioral health services are difficult because you don't have a test of blood or an x-ray that shows you exactly what the problem is. And so it's really up to the clinical judgment and training and expertise of the providers. And I think it causes the legislators to be wary, if you will, about expenditures on behavioral health. Next, please. So good news, there are two new Medicaid waivers that are actually moving ahead. One is, it's actually a state plan amendment called a 1915I, and it has a new name called RISE, Resiliency and Self-Determination. But it serves people with severe mental illnesses. Those are people with schizophrenia, schizoaffective disorder, bipolar disorder, or significant and major depression. And this is a group of people in Kentucky that have really not had a waiver, and we're just delighted that it's finally coming to fruition. The most important services that they will get are supported housing, which is housing not only with a roof over your head, but also the supports to keep you on track with your therapy and your medication management and so forth. Supported employment, respite if needed by the family members who have been caregivers. So lots of things. They've been doing a lot of outreach since July to get enough providers, and they continue to do that. They cannot enroll recipients and go through that process until we're sure that we have enough providers to provide all the services. The second waiver that addresses a different population, but also one beset by behavioral health issues, are those people that are currently incarcerated, either in prison or in a DJJ facility, and have a mental illness or a substance use disorder. Typically, Medicaid is suspended during a period of incarceration, but this waiver allows for services for behavioral health, including medications and therapy, to be made available 60 days prior to release. They get the person in touch with their MCO so that there's a seamless transition, what we call a warm handoff, when they are released. And so hopefully we don't lose people in that period of time after they're recently released and before they can get into treatment. So we're looking for some great benefits from that. It will begin in October of this year and be fully implemented by April of next year. Next, please. So there are a lot of Medicaid waivers for Kentuckians with special needs. These are traditionally people that have developmental and intellectual disabilities, mobility disabilities, or age. And it allows people, some 33,000 Kentuckians are currently on these waivers, to be treated in their community so they don't have to be institutionalized in a nursing home or an intermediate care facility. So with tremendous advocacy by parents and family members and consumers and advocates, got more funding in the last biennial budget than we've ever had, and 1,925 new placements in these waivers were approved. that's the good news. The bad news is that those slots have all now been filled and the waiting list continues to grow. So we're up over 16,000 on the waiting list for these waivers, which is actually more than the waiting list was 2 years ago when we did all that advocacy. So that's going to be another voice to our legislators in terms of the biennial budget. We also will, because CMS is requiring it, establish a new beneficiary advisory council made up of current and past Medicaid members, parents, families, or caregivers. And this is really exciting because it will give a real voice to people that know the Medicaid program intimately, either as recipients, family members, or caregivers. And the new members have been announced by DMS in July, and we're hoping that that first meeting of the BAC will be held in October. So that's a significant step forward. Next, please. So just a reminder that LGBTQ Kentuckians are not by their nature necessarily prone to behavioral health problems, but they also are very often the target of discrimination and bullying and so forth. So particularly in our schools, Senate Bill 150 in the 2023 General Assembly changed many things about the way schools handle LGBTQ kids and made it much more difficult for them to find schools to be a safe and supportive environment. An executive order that the governor signed last September to ban conversion therapy, which is really conversion torture. It's actually not an approved therapy to protect LGBTQ kids, was attacked by House Bill 495 in the past session, which overturned the executive order. The worst of the language was taken out, but it did ban Medicaid payments for services provided to adults seeking gender-affirming care. Two other bills in that session, Senate Bill 2 bans the delivery or the continuation of gender-affirming care for Kentuckians who are incarcerated. And then HB 4 prohibits all diversity, equity, and inclusion policies, teachings, and programs in our post-secondary institutions. And a number of those were for the support of LGBTQ students. So lots of stress for this portion of Kentuckians. Our statistics are here. We don't have great statistics on self-harm in Kentucky. A very promising program is one that's directed to our farmers, and there's a link there. They actually are doing a lot of outreach to young farmers, future farmers of America, and 4-H clubs to get people thinking about their mental health. And for LGBTQ kids, we recommend, or adults also, the Trevor Project is an excellent resource. We're concerned that House Bill 48 reduces the frequency of trainings for school staff about preventing suicide prevention, which is really the uptick in Kentucky. So not good news there. Next, please. This is a great resource, Finding Help Now. If you've got somebody that you know that needs mental health, substance use disorder treatment, recovery housing, naloxone, and so forth, this is updated by the providers on at least weekly, if not more often, so that if you're looking for a resource, you can do it by geography, you can do it by the type of problem, you can do it by the kind of payment mechanism that you have, and it will tell you who is taking new patients, whether there are beds available, and so forth. It's all online there, and I really recommend it highly, particularly if you're in a pickle and need help as soon as possible. And next, please. The 988 hotline has been in existence nationally for 3 years. Third anniversary was in July. I'm very proud of the way it's handled here in Kentucky because all of those calls with a Kentucky area code are answered locally. So many other states farm those out to big call centers in Florida or New York or California. And so we're able to talk to people and give them resources right here in Kentucky. Unfortunately, special funding for number 3 option for LGBTQ callers was defunded in July, so that option is no longer available, but I refer you to the Trevor Project. They can also get good immediate crisis intervention by simply dialing 988. Next, please. And I just want to remind you, these are tough times, and I think we're all feeling it. So like on the airplane, when they say if the oxygen mask drops down, put yours on first and then tend to the people with you who may need help with their oxygen mask. Really, really important that you keep a kind of an eye on yourself or ask a trusted somebody to keep an eye on you. You're under a lot of pressure in the kind of work that you do out in the community and so forth. So you really need to take care of yourself. Here's a couple of ideas about what to look for in terms of symptoms. Mental Health America offers online confidential screenings that can give you some feedback about how your responses line up with those who have identified problems and so forth, and will give you some helpful resources as well. And finally, when in doubt, reach out for help. It's always better to catch a problem early on. So thank you for that. And I think maybe that's it. Yeah. Turn it over to Priscilla. Thank you.
Thanks, Sheila. Hi, everyone. I'm Priscilla Easterling with Kentucky Voices for Health. Today, we're going to cover Medicaid and Marketplace updates. Next slide, please. So we've talked about in the last couple of months the One Big Beautiful Bill Act and some of those key requirements, some of those key impacts. So just to sort of summarize that, and then we'll talk a little bit about some of the implementation timelines and how that is going to happen for Kentucky, how Kentuckians are going to see that. Sorry about that. So the mandatory work requirements, that's 80 hours a month with verification. That's risk losing coverage for up to 282,000 Kentuckians. We've seen a few different numbers, but they're all around that area. Mandatory co-pays of up to $35. That's a big one that a lot of people are not talking about, but that's definitely going to impact people at the point of service. We saw before when there were copays, even as little as $1 or $2, that was enough to discourage people from going to the doctor and seeking the treatment that they needed. And so whether it's $35 or whether it's $1, mandatory copays are just going to prevent people from going to the doctor. It's $35 is a water bill, and food for a family, all of that. So very concerned about that. The frequent redeterminations, right now we're on an annual cycle. Part of this bill increases those redeterminations to every 6 months. And that is absolutely gonna not only I worry about how many people are going to get lost in that paperwork shuffle. That's a lot, as now people only have to do it once a year, and they still often struggle with that process, whether it's finding the right documents to submit, making sure they submit all of the documents, making sure that they can even submit them to connect, like actually upload them into the system. We've heard stories about people uploading those documents and those just disappearing, mailing them to DCBS, and them also just not getting filed in. And so just with that increased number of redeterminations, also very concerned about how many people are going to be losing their coverage, not because they're actually ineligible for Medicaid, but because they get stuck somewhere in this paperwork process. So there's also funding restrictions, and just overall, we're looking at around 250,000 Kentuckians who are expected to lose coverage, and our uninsured rate increasing again. Next slide, please. So as we talked about, here's the implementation timeline. Now for Medicaid, a lot of those, the sort of good news is a lot of those changes don't go in effect until next fall. So this time next year, we'll be talking about this is what's happening next month. But for the ACA side of the house, a lot of those provisions a couple of big provisions are going into effect at the end of this year. So one, the special enrollment period for 100 for folks who low income special enrollment period for folks who are at 150% of the federal poverty line or below, that ends at the end of this year. That just goes away. They're also going to be recapturing excess premium tax credits. So that's part of the reconciliation process right now when folks file their taxes, but it's been mostly suspended. So if the feds overpay you in your premium tax credit within a percentage, they don't actually recapture it. They are going to start recapturing that excess premium tax for beginning next year. And then the other really big one that I'm really sad to see, really concerned about, is that it eliminates subsidies for all lawfully present immigrants with incomes under 100% of the federal poverty line. So right now, for immigrants who would be eligible for Medicaid, but for their immigration status, they're usually subject to that 5-year bar. They're currently able to get subsidized plans through the marketplace so that they're still able to access affordable health care. But this One Big Beautiful Bill Act eliminates that eligibility. So beginning in January, they're going to lose that eligibility, which is a really unfortunate. We're putting together a great one-pager that sort of walks through all of these different eligibility changes. So look for that in the next few weeks or month or so. Next slide, please. All right. So also just to talk about work reporting requirements. They currently exist with SNAP, and what we do know is that work reporting requirements are just confusing, and they often cause people to lose coverage without actually helping them find a job. And they waste millions on paperwork. It hurts the economy. We're also talking about speaking of paperwork, it's also a lot of paperwork for the state to have to process, like just that physical load. We already hear big delays, especially during open enrollment, during peak seasons, where folks submit their paperwork and it can take way longer than the 30 days that they typically expect for them to process those applications, process that paperwork, and make a determination. And so just very concerned about all of that. And while there will be work reporting requirements, so folks will have to report that, there will still be exemptions, but the question is, what do those exemptions look like? What paperwork is needed to be able to get those exemptions, which will be even more paperwork. And if folks, say, have a disability or have a healthcare issue that they would like, that may qualify as a work reporting exemption, how are they able to get that paperwork signed if they do not have Medicaid, if they do not have the coverage that they need to be able to get a provider to sign off on that paperwork? So it's really going to be important during the implementation phase as the state is developing those rules and what it looks like. It's really important that we're make sure that we're advocating, we're making our voices known, we're participating in that process, because there are lots of situations and scenarios that where folks are just going to get stuck that could be eligible for an exemption, but just because the process is confusing or the paperwork is too much, that they may not be able to get that exemption and lose their Medicaid coverage. So again, also very concerned about this. Next slide. And so all of that to say that harm mitigation absolutely starts now. So, as the state is building out those implementation plans, as the federal government is sharing guidance and the state is redesigning their system, there will be lots of opportunity to participate in public comments. Look for any opportunities to participate in system design meetings, system testing, all of that. And if you're able to, also attend committee meetings and schedule individual one-on-one meetings with your local legislators so that you can talk to them about the impact of the One Big Beautiful Bill Act on yourself, on your community, on your family, all of that, on your clients. So It's a good time to participate, and still there's a lot of harm mitigation that we can do during that implementation phase. So next slide, please. And so other big thing happening on the marketplace side of things that's not related to the One Big Beautiful Bill Act, but it was not included in that bill. But the enhanced marketplace subsidies are currently scheduled to expire at the end of December. Now, this is a big deal. Emily had already mentioned this at the open during the federal section earlier. Just wanted to walk through a couple of bits more, a little bit more information. So part of what makes the coverage on the marketplace so much more affordable are these premium tax credits. Those premium tax credits go directly to the insurer, and so that the individual or family, their monthly premium is as low as possible. So with the expiring enhanced subsidies, with that already sort of on the bubble, we've already seen the insurers get very nervous about what enrollment in the marketplace is going to look like for 2026. And they requested some of the highest rate increases that we've ever seen for 2026. Anthem requested 23%, Molina 15%, WellCare 37% increase. And that is without the enhanced subsidies without that increased cost from those enhanced subsidies going away. This is just the base rates. Now, it is sort of presumed that those rates they filed those rates with the assumption that the enhanced subsidies would not be extended. So there's still some wiggle room. There's still a little, hopefully Congress will act. That's why it's so important to make sure that they do act and pass a bill to at least extend this for another year, but honestly to make this permanent. We've seen so many more people able to get enrolled in marketplace coverage this year just because of those enhanced subsidies. And each year it's gotten more and more since 2021, since those enhanced subsidies have been in place. There's this fun if you're a nerd. There's a great calculator that KFF put together, Kaiser Family Foundation put together, that will let you put in your specific situation, number of adults, number of kids, income, all of that into the calculator, and it will tell you what your estimated income change will be. I went through a couple of scenarios just with a family of 4, 2 adults, 2 children enrolling. And at all of these different incomes, we're seeing a huge increase in that premium. It's not just a double, it is huge. And how many folks do you know right now who could just swing an extra $200 a month in their health premium? That's not even talking about actually accessing care. That's not going to the actual doctor. That's just the health insurance premium. So again, it's very concerning. We're very nervous about the subsidies expiring, the enhanced subsidies expiring, because that increase is going to be incredible, especially in a bad way. It's going to be very intense in a very bad way for families who are already struggling to pay for all of these, struggling to pay for groceries and all of these other aspects of life that are getting more and more expensive. So with that, next slide. All right, so we've talked about a lot of the federal things. If you're interested, if you are just feeling like, man, a lot of this sounds like bad news, what do I do? How can I get involved? How do I do something? Thing you can do: join the Keep Kentucky Covered Coalition. We rebranded from maybe not officially, tomorrow I think is the official rebranding day, from the Kentucky Medicaid Defense Coalition to just Keep Kentucky Covered, because we are talking about things beyond just Medicaid. We're also talking about marketplace, and it's so important that we are coming together, meeting, talking, getting organized, and making sure that we have a plan for advocating and raising our voices about how important these policies are to our communities. So join. Our next meeting is tomorrow. It's at 3 p.m. You can reach out to Morgan, and I think Holly also dropped that in the chat. Next slide, please. All right. So now to switch to the state level, side of things really quick. I do want to do a fantastic plug for connectors. I'm a little biased because I'm also a trained connector, but connectors are an incredible free resource in all 120 counties, and they help individuals and families with all of the things that we've talked about and will continue talking about. They can help find coverage, they can help assist with the application and enrollment process, create referrals for resources, and they can also help apply not just for Medicaid and marketplace coverage, but also for SNAP and CCAP as well. And maybe one day WIC when it's actually finished being integrated into the system. So you can report any changes and they can help report any changes in information and recertify benefits. But all of this like healthcare stuff is incredibly complicated for most folks, and connectors are a great resource that can really help walk families through that entire process. So if you don't know the connectors in your community, you can find them at connect.ky.gov. They're a great resource to be able to refer folks over for that warm handoff so that we make sure that folks in our community, our clients, have access to the healthcare that they need. So next slide. Connectors can also help with child renewals, which is a big deal. This went back to normal beginning in July. So we're now on our third month. Oh, wow, that's so fast. July, August, September is our third month. So first notices went back in May. The most important thing to do to know about all of this is to make sure contact information is up to date in Connect. The contact information that is in Connect is where those notices get mailed to. So if folks have moved at all in the last year, in the last 3 years, 5 years, 6 years, whatever, make sure you just go into Connect and double check that your contact information is still up to date. Because if they mail the notice and ask for information and you don't rescind that information, folks could lose their coverage. So it's super important. You can do that by calling the call center, reaching out to a connector. You can ask your doctor's office to also check your renewal date in KY HealthNet portal. And we have a great one-pager here that's linked. That's both available in English and Spanish, that sort of walks through steps 1 through 4. What do you need to know? What do you need to do? What that notice looks like, and what to do if you lose coverage. And there's also a great DMS children's renewal packet that sort of explains a lot more context to this, but super important. If you know folks who have kids who are enrolled in Medicaid, please make sure that they know that Medicaid, that their child might have to do a renewal this year. And then you can share that flyer with them. Next slide, please. Also important note about child renewals is that the income limits for children are much higher than they are for adults. So looking again at a family of 4, the income limit for adults is $44,376. So for a family of say 4 making $45,000, the 2 adults in that household would not be eligible for Medicaid, but both children would be, and they would be up to 70,000. So it's super important to not assume that just because the parents are not eligible for Medicaid, that nobody in the household is eligible. When in doubt, just fill it out and let the state make that determination for you. And kids are granted 12 months of continuous eligibility. So once they're approved, they're all set for a year. So again, just when in doubt, fill it out. And Holly dropped the federal poverty level chart in the chat just for reference. Next slide. So looking at the first month of, okay, just a reminder, these are the 3, I thought I had a transition that I didn't. These are the first 3 months of wow. this is just an example of the notices that folks might receive: the notice of eligibility, an RFI or renewal packet. For the notice of eligibility, it's just a letter saying, hey, you're great, you've been extended for another 12 months. For an RFI or a renewal packet, they're both asking for information that you have to send back. That this is where it's super important to make sure, where are these going? It's super important to make sure that if you get one of these notices asking for information, you send that information back in, because if you don't, you could lose your coverage, or your clients could lose coverage. These renewals are back on track, and so this will be happening for the next 12 months, for the first time for all children. But for adults, it's been ongoing since 2023. So these notices, to check your renewal date, you check that in Connect, or again, ask a connector or ask a provider to check KY HealthNet. The notice goes about 45 days before the renewal date. So for literally right now, this week, notices are going out for folks who are due at the end of October. So that's the rough timing. So make sure to keep an eye out for that. Next slide. Yes, and so if you lose any coverage, make sure you go into Connect or work with a connector, call the call center, update your contact information, update your application, report any changes. It'll run a redetermination at that point. If for some reason it still deems you ineligible, you can double check that if they ask for any information. If they ask for information, go ahead and submit that. You have 90 days from the time that you lose coverage to submit information and request a reinstatement. So if you submit that information and DMS still approves, they can reinstate your coverage all the way back to the date of loss of coverage, so that you don't have a gap. And then if they're still saying you're not eligible and you think that you are, you can always go through an appeals hearing as well. Next slide. All right, I'm going to kind of run through this a little bit. So the first month of Medicaid renewals data showed that just over 48,000 cases, that there were around 448,000 total cases due for renewal, 4,900 terminations overall. Of those 48,000 total cases, 8,400 were children, and roughly 950 of them were terminated, and about 600 of them were for procedural reasons. Again, meaning they were terminated not because they were not eligible, but because they did not turn in documents. So again, it's super important to make sure you send in any requested information. Next slide. And this is just the case distribution, noting that November and December, those case distributions for children are going to be a little bit lower to account for holidays and open enrollment. Next slide. And as a reminder, open enrollment for Medicaid is always open. You can always submit an application. For marketplace coverage, open enrollment is getting ready to start November 1st, and it will run through January 15th this year. So super important. That has not changed for this year. That will run as normal. Medicare starts in just about a month, October 15th, runs through December 7th. And if you need any help navigating any of that, find a connector or find a ship coordinator for Medicare. Both are incredible resources, and they can walk you through all of this. Next slide. And just a reminder, the DMS hosts an ongoing stakeholder engagement meeting. That's the third Thursday of each month at 11 a.m. This next meeting is this Thursday, and that's where they will go over August child renewal data. So if you're interested and you want to know more about how that's going, that's definitely a great opportunity to hear that directly from the state, and you can join by clicking the link there. Next slide. Great. And so just some other health resources. We have our Keep Kentucky Covered toolkit that's helpful for your advocacy. Our team has put together a lot of great resources about work reporting requirements so that you can talk to folks about that. Economic impact of Medicaid on Kentucky county by county enrollment data, talking points about the One Big Beautiful Bill Act, graphics, and other just Medicaid defense resources. And then we also have KY Loop, which has a bunch of a bunch of helpful one-pagers about healthcare language access, non-emergency medical transportation, more about those special enrollment periods, the family fix, work reporting requirements, KTAP, a lot of other great resources from our Thrive partners as well. Next slide. And with that, I will turn it over to Adrian. Thank you.
Thanks, Priscilla. Hi, everyone. I'm Adrian Bush. I'm with the Homeless and Housing Coalition of Kentucky, here to provide an update on housing assistance and homeless services. Next slide. Okay, so since we last had a webinar, the National Low Income Housing Coalition has released their Out of Reach report, which seeks to quantify, calculate what does it actually take for somebody to get by and rent a 2-bedroom home affordably in Kentucky. And so we know that as of this year, our state housing wage, that's the number, for a 2-bedroom apartment, it now takes someone earning $21.47. That's the average across the state to make that math work. And that's because rents have gone up so much. Fair market rent, which has usually kind of lagged behind what we're seeing in the real world, is now over $1,000 a month across Kentucky. So the most expensive areas include the metropolitan areas, of course, but also the third most expensive area I want to note is actually the Clarksville metropolitan area. Even though Clarksville is in Tennessee, some of our Western Kentucky counties are actually included in it. And you can actually look up your county or area by clicking on the graphic. Next slide. All right, so on the federal front, we know housing is getting more expensive. We're looking to, our elected officials to see what they want to do about it. In housing assistance, the money that comes for public housing, homeless assistance, other affordable housing development comes from the appropriations side of the budget. And back in May and June, the White House actually proposed to eliminate some critical federal grants, including the Home Investment Partnerships Program. Their proposal also included a cut to rental assistance by way of public housing by 43% and limiting assistance to 2 years. They proposed to eliminate the Low-Income Home Energy Assistance Program, or LIHEAP. They proposed to cut fair housing funding by $60 million nationwide, as well as block granting and cutting homeless assistance and limiting participation to those programs, including permanent supportive housing, to 2 years. So the White House issued its proposal. The House and Senate also have to come up with their own because Congress is actually the one in charge of appropriating the funds. And so the House proposal goes along with the White House's in terms of eliminating critical federal grants, including the home program, but it does level fund rental assistance and homeless assistance instead of block granting it and cutting it. But the thing with level funding is if you are providing rental assistance, because those rents, as I mentioned before, the fair market rents keep going up, level funding actually acts as a bit of a cut. Next slide. On the Senate side, the Senate appropriators proposed to level fund the home program instead of eliminate it. And they also propose a modest increase, which basically level funds rental assistance and homeless assistance. It's not quite enough to keep up with the number of people currently on the program. There's a modest increase for LIHEAP, which again, given utilities and utility usage, basically level funds it. So what we're looking for next is some sort of reconciliation between the two versions. The federal fiscal year starts October 1st, which is coming up very, very soon. And so what Congress can either deal with all 12 appropriations bills and get it to the president's desk for his signature, or they could issue a temporary funding agreement. The latest conventional wisdom from the Hill is that they will issue a continuing resolution, vote on a continuing resolution that will last through November. Buys a little bit of time to come to more agreement on both the numbers and the programming. So we will see about that. Another option is for the government to shut down. And I think that is, we will see what happens between now and October 1st. With future appropriations and agreements, we may start to see increased rents on public housing folks, as well as work reporting requirements. That remains to be determined. Next slide. Okay. Also from the White House has the ability to submit executive orders. And this White House did, back in the beginning of August, issue an order called Ending Crime and Disorder on America's Streets. That really is, it's an order that looks at visible homelessness as a problem that is really rooted in mental illness, mental health, addiction, substance use disorder, as opposed to fundamentally a housing problem. And so it calls for federal agencies to really start enacting these policies around forced institutionalization of people suffering from addiction and mental illness, requirements of federally funded programs to share personal and health-related data with law enforcement in the name of efficiency, and programs receiving federally funded homeless assistance to put up additional ineffective barriers of treatment and supportive services as a condition of receiving housing assistance instead of as a wraparound support. Next slide. So on the state front, our legislators are in the middle of the interim, as discussed earlier. And so they did create a housing task force that first was initiated in 2024 and then was reconvened in 2025. So it has met in June and July. And its next meeting is actually on Monday, September 22nd. You can check it out on KET, or the LRC has a YouTube channel, and you can see who the members are on the right-hand side of the slide. It's pretty, I think the legislators really worked to try to achieve some geographic diversity and coverage across the state. So you should check it out. The first couple have dealt with the overall supply gap, as well as some solutions that other states are doing, and have had lots of presenters from the Kentucky Chamber, as well as some national groups presenting as well. Next slide. There's also a disaster prevention and resiliency task force. As we know from the floods and tornadoes we've experienced over the last 5 years, housing is a critical component of disaster recovery, so we are monitoring this task force's activities as well. Next slide. All right, so our fundamentals for our state housing solutions. In order to increase our housing affordability and supply for extremely low income Kentuckians, we need to think about what we're building for those folks. We need to improve access to housing for people who are housing insecure or homeless. And we need to create statewide renter protections. So some of the bills that we worked on last year and will be working this interim as well as this upcoming legislative session are modernizing and indexing the fee structure that funds our state affordable housing trust fund so we can build for people making 60% or below of the area median income. And then House Bill 534 last session is record sealing for dismissed eviction and expungement for minors improperly listed. And then lastly, Senate Bill 59 has the nickname of Yes in God's Backyard, with streamlined planning and zoning requirements for religious institutions to develop affordable housing. Next slide. All right. So if you're interested in taking more action, tomorrow we're having a virtual Capitol Hill Day around the appropriations process. But there's also a sign-on letter and toolkit from the National Low-Income Housing Coalition. On the state basis, if you're interested in eviction record sealing advocacy, just let me know. And then locally, if you're interested in trying to increase housing supply in your community, the American Planning Association has a great toolkit called the Housing Supply Accelerator. And with that, I'll turn it over to Emily.
Took me a minute to unmute. Sorry, folks. Thank you all again for your time today. We have some resources here that we usually don't have time to go through at all because we're almost always at time whenever we get here. But just so a reminder, I covered this at the beginning. Here's our schedule for the rest of the year. So please continue to join us and share this information with your colleagues if you find it helpful. You can go to the next slide. Our explainers. I think this came up in a few different sections that we have lots of materials on these different types of programs and resources. And this is a really good kind of landing page where you can see what those one-pagers are in English and Spanish links. And of course, you can see them at KY Loop as well. And we'd love for you to use these, share them, and let us know if there's other information, you know, a different program or another population that we need to really focus on when we're creating some of these materials. Go to the next slide. I think everything else here are some of the kind of standing resources that we have for food, housing, healthcare, and I won't go through all of them individually. Just know that they're here. We always include them at the end of the slide decks. And I think the very last slide is our evaluation slide. And I'll just do one more plug for getting your feedback. We always like to know what information is most helpful to you, what information you want more of, what you could do with less of, and, you know, just ideas for future topics that we can be covering. And as we've been talking during the past 90 minutes, there is another update for you. I just saw that about an hour ago, House Republicans released their plan for a continuing resolution that would fund the government through 11/21, November 21st. And this plan does not, and I'm putting it in the chat right now, this plan does not include the extension of ACA enhanced premium tax credits. So we need more advocacy. Our legislators, our members of Congress need to hear from us. So there's a link to an article about it that doesn't have a paywall. And just go back to those numbers for your members of Congress. Please reach out. And thank you all again. Of course, we'll be sending out all of this information in a follow-up email in the next couple of days. So watch for that. And if you have questions, if you just want to connect and get more involved, please reach out. We really appreciate you. And I hope everybody has a good day.